నమస్తే, వెల్కమ్ టు జీ తెలుగు న్యూస్. ఊబకాయం ప్రస్తుతం ఎక్కువ మందిని వేధిస్తున్న సమస్య. బరువు తగ్గడం కోసం ఎంతో మంది ఎన్నో ప్రయత్నాలు చేస్తుంటారు. అయితే ఊబకాయలకు వరంగా మారుతోంది బేరియాట్రిక్ సర్జరీ. ఈ ప్రక్రియతో బరువు తగ్గించుకునే అవకాశాలు చాలా ఎక్కువగా ఉంటాయి. ఈ ఆపరేషన్లు ఆహారం తీసుకోవడం పరిమితం చేయడం ద్వారా ఊబకాయానికి ఒక వ్యక్తి యొక్క జీర్ణ వ్యవస్థను సెట్ చేయడానికి ఉపయోగపడుతుంది. డైటింగ్ మరియు వ్యాయామం ద్వారా బరువు తగ్గించుకోలేని వారికి బేరియాట్రిక్ సర్జరీ సరైనదిగా తెలుస్తోంది. బేరియాట్రిక్ సర్జరీ అసలు ఎలా చేస్తారు, ఎలాంటి వారు ఈ సర్జరీలు చేయించుకోవచ్చు, దీనికి ఎలాంటి కాంప్లికేషన్స్ ఉంటాయి అంటే సర్జరీ అనగానే జనరల్గానే చాలా మందిలో చాలా భయాలు ఉంటాయి. సో ఈ అంశాలపై లాప్రోస్కోపిక్, రోబోటిక్, ఒబెసిటీ అండ్ హెర్నియా సర్జన్ డాక్టర్ అభిషేక్ కటక్వార్ మనతో ఉన్నారు. వారితో మాట్లాడదాం. నమస్తే డాక్టర్.
నమస్తే.
సో అంటే ఒబెసిటీ చాలా చాలా కామన్ అయిపోయింది. ఈవెన్ ఇండిపెండెన్స్ డే రోజు ప్రధాని మోదీ కూడా ఈ విషయంపై మాట్లాడారు. భారతీయులు చాలా బరువు పెరిగిపోతున్నారు, తగ్గాలి అని. అంటే సమస్య తీవ్రత ఎక్కువగా ఉంది కాబట్టి ప్రధాని కూడా ఆ రోజు మాట్లాడడం జరిగింది ఈ విషయంపై. సో మీరేం చెప్తారు డాక్టర్? యాజ్ ఎ డాక్టర్ అసలు ఎలా ఉంది, ఎందుకు ఊబకాయం పెరిగిపోతుంది అంటే ఏం చెప్తారు?
See, first and the most important thing is I want to tell you some statistics about the obesity. 1 in every 4 person in India is obese or overweight, which is a big problem. In fact, there is a new study which has come up from ICMR which says that obesity is not just common in an individual but it is also common in couples. And the highest obesity rate is seen in Kerala. Now Kerala is famous for another thing, which is they have the highest literacy rate, but at the same time they have the highest obesity rate in India, which is very surprising.
Oh, why in Kerala, doctor?
There could be many reasons. One of the most important reason could be the genetics. The second reason could be sedentary lifestyle. Third reason could be because as an individual we have seen that it is not just the change in food but westernization which has happened. Okay. And I feel that a lot of Kerala people have moved to abroad.
Yes.
And once they come back to India, they don't go back to their routine, their culture and everything, and they adopt more of the Western lifestyle, eating junk food, eating fried food and all those things. And probably over years this has changed, and that's why maybe obesity rate is highest in Kerala.
Okay. So డాక్టర్, యాక్చువల్లీ ఆఫ్టర్ కరోనా అందరూ కూడా కొంచెం కాన్షియస్ ఉన్నారు. లైక్ హెల్త్ విషయంలో దే టేకింగ్ కేర్, రైట్? లైక్ ఫుడ్ విషయంలో, డైట్ విషయంలో, డూయింగ్ ఎక్సర్సైజెస్ ఈవెన్. బట్ స్టిల్ కొంతమంది ఫుడ్తో, ఎక్సర్సైజెస్తో బరువు తగ్గించుకోలేరు డాక్టర్. సో అలాంటి వాళ్ళకి ఈ సర్జరీ ఎంత హెల్ప్ అవుతుంది అంటే ఏం చెప్తారు?
So very interesting question. See, before COVID, everybody used to think that obesity is a sign of prosperity. If you are overweight or obese, probably you are rich and you have a lot of money. But in COVID, we realized very important thing that if your body mass index is more than 35, you had 7 times more risk of getting severe COVID and landing up on a ventilator. Now after COVID, people have realized that yes, obesity is a disease, and then people started thinking how to cope up with this problem, which is a new epidemic, that is what we call. And then they realized that they have to manage it by some way, and then they realized that bariatric and metabolic surgery is one of the safest, and it has been proven method not just for treating obesity but also for diabetes. That is why we call it bariatric and metabolic surgery.
Okay. So doctor, actually ఆర్తి అగర్వాల్ యాక్ట్రెస్ ఇస్ దర్, రైట్? సో ఆమె ఈ సర్జరీ వల్ల చనిపోయారు అని చాలా ఊహాగానాలు వచ్చాయి. దాంట్లో నిజం ఎంత ఉందో మాకైతే తెలియదు. సో యాజ్ ఎ డాక్టర్గా మీరు ఏం చెప్తారు డాక్టర్? నిజంగానే అంత సివియారిటీ ఉంటుందా ఈ సర్జరీ వల్ల పేషెంట్కి ప్రాణం పోయేంత? ఏం చెప్తారు?
See, first and the most important thing I want to clear on this media, that the actress you name,
yeah,
she went to US for liposuction. And liposuction and bariatric surgery are totally different. Liposuction is a cosmetic surgery, whereas bariatric surgery is considered as a metabolic surgery. Now the important thing is she had a liposuction, and I would say massive liposuction, in which they tried to take out a lot of fat from her abdomen or from her tummy, which might have led to blood clots and which might have gone to her lungs or her brain. Now, in bariatric and robotic surgery, things have evolved, and maybe because it happened 10-20 years back, people had no idea about bariatric and liposuction. They used to confuse between it. And since bariatric surgery was quite new in India during that time, so everybody thought that it is because of the bariatric surgery.
Yeah.
But believe me, it was not because of bariatric surgery, it was because of liposuction. Now, another question which you asked me very clearly, what is the risk involved in bariatric and metabolic surgery? So I always give this example that somebody who has obese or overweight already has thyroid issue, already has a fatty liver, already has impaired cardiac functioning, they are already having breathing issues, they can't walk, they become breathless, they have gurga or sleep apnea. Now, the risk is because of all these problems. The risk is not because of surgery. In my career of more than 15 years, I'm very proud to say that we have never lost a single patient after surgery, and I'm so proud of that. And the credit doesn't go to me, it goes to the whole team, because there are a lot of people involved along with surgeon, which include a pulmonologist, a good anesthetist, a good critical care specialist, a good cardiologist. And so far in my career, we haven't lost, and we are very proud to say that.
Okay. సో మీ కెరీర్లో ఎప్పుడు కూడా పేషెంట్ ప్రాణానికి ఎప్పుడు ఏ ప్రాబ్లం రాలేదు, రైట్, ఆఫ్టర్ సర్జరీ?
సో ఇన్ ఫ్యాక్ట్ though we did not have had any mortality or any death in our career, but I have treated many patients who were operated outside India, outside Hyderabad. In fact, I do get a lot of patients from Middle East, Australia and US and Canada, and they had this surgery somewhere. Unfortunately, this is a very important thing. A lot of people from US and India are going to Turkey, because Turkey has become a hub of such surgeries. You know, they get it done for a very low price, but they don't realize that more than surgery, it is important what if you have some problem after surgery, how are you going to manage it? You can't fly back to Turkey for these problems. So a lot of people who get operated in Turkey and all those Middle East countries, they come to us with some complication and we try to help them out.
ఓకే డాక్టర్, ఇప్పుడు మీరు మెన్షన్ చేశారు ఫ్యాటీ లివర్ ఉన్న వాళ్ళకి వెయిట్ తగ్గడం అనేది వెరీ ఇంపార్టెంట్. సో ఇప్పుడు ఫ్యాటీ లివర్ వెరీ కామన్ అయిపోయింది డాక్టర్, అందరిలో ఉంటుంది, ఆల్మోస్ట్ ఎవరు టెస్ట్ చేయించుకున్నా ఫ్యాటీ లివర్ ఉంటుంది. అలాంటి వాళ్ళు డెఫినెట్గా వెయిట్ తగ్గాల్సిందే, డాక్టర్స్ వాళ్ళకి సజెస్ట్ చేస్తారు. సో అలాంటి వాళ్ళు బేరియాట్రిక్ చేయించుకుంటే ఎంతవరకు హెల్ప్ అవుతుంది? ఈజ్ ఇట్ సేఫ్ ఫర్ దెమ్?
Yes, so let me tell you what is fatty liver first.
Okay.
So, you know, our liver is the filter. In our car also we have a filter. So filter is nothing but like a sponge.
Yes.
What happens if you continuously use your car with bad oil, without servicing, without taking care of anything? It gets smushed. And the same thing happens in liver. Whatever you are eating, whatever toxins you are taking in your food, it goes and filter tries to save it, and it does not allow those toxins to enter in your body. Now, in doing that, obviously when you gain weight, there's a lot of fat which deposits into the liver. That is what is called fatty liver. Now, there are two ways to manage or evaluate fatty liver. One is called ultrasound. Most of the people who have their ultrasound, they come to know fatty liver grade 1, grade 2, grade 3 and grade 4. Now, if you have grade 1 fatty liver, it's okay. Don't get surprised and shocked. Most of the Indian population have grade 1 fatty liver. Even if you are not obese, even in the lean people, we tend to see fatty liver.
Okay.
Now, the problem starts when you have combination of fatty liver, obesity and diabetes. These three are the deadly combination, because obesity will lead to fatty liver as well as diabetes. Diabetes will cause more fatty liver. Fatty liver will cause more diabetes and more obesity. So, if you have a combination of fatty liver, diabetes and obesity, that's not a good combination.
Okay.
The other way to measure fatty liver is by doing liver function test. In liver function test, there are two important markers. One is called SGPT and one is called SGOT. Normally, their value has to be less than 40. So, we have two ways of measuring fatty liver. One, how big is your liver, which is by ultrasound. The second is how is your liver functioning biochemically, which is by liver function test. lot of time people will have only fatty liver on ultrasound, but their liver function test might be normal. So it's okay, just focus on your lifestyle and it will improve. Coming back to your question where you asked me how bariatric surgery will help in reversing fatty liver. So in my career, I have operated people with even grade 4 fatty liver.
Oh.
Their fatty liver reversed after a span of 1 year. Within 1 year, their fatty liver reversed because once they start losing weight, their metabolism improve, their insulin resistance goes down, and by doing that, their fatty liver reverse. And we have done liver biopsies, we have done MRI to evaluate that. And all of them, and we could save their liver transplant, because if we don't do that, someday they will land up in acute problems and acute liver failure.
Yeah. So fatty liver ఉన్న పేషెంట్స్కి ఈవెన్ గ్రేడ్ 4 స్టేజ్లో ఉన్న వాళ్ళకి చాలా హెల్ప్ అవుతుందంటారు.
Yes, yes. Okay. It is very helpful. The only problem is once your liver goes into irreversible damage.
Okay.
And irreversible damage or decompensated stage, that happens when you develop water in your abdomen, which we call ascites. So if somebody has an ascites, it means that it has gone beyond repair.
Okay.
Then bariatric surgery won't help.
Okay.
Because liver is already damaged.
Okay. డ్యామేజ్ అయిపోయిన తర్వాత ఇట్స్ టఫ్. ఓకే. సో డాక్టర్, ఇప్పుడు డెడ్లీ కాంబినేషన్ అని చెప్తున్నారు, డయాబెటీస్, ఒబెసిటీ అండ్ ఫ్యాటీ లివర్. జనరల్గా డయాబెటిక్ పేషెంట్స్కి సర్జరీ అంటేనే తొందరగా హీల్ అవ్వదు, టఫ్ అంటారు కదా డాక్టర్. మరి దిస్ ఇస్ ఆల్సో సర్జరీ.
So I give you an example. Whenever we do something in life, we always do risk calculation. If there is some benefit with some risk, then we should always take that risk, because there are great benefits involved. So I do operate a lot of diabetic people. Some of them are on insulin, some of them taking 2 or 3 medicine for diabetes, and you will be surprised to know that within 24 hours their sugar level comes normal, because once we do this surgery, the hormones change immediately, and once the hormone change, immediately their sugar metabolism improves. Some of them who are on insulin, they don't need insulin. Some of them who are on diabetes medicine, their requirement for medicine goes down. And some of them can't believe that within one surgery, everything gets started reversing. So sometimes it is difficult to believe. It is too good to believe. But that is why we have started this support group system, wherein we ask people who had this surgery, we ask them to burst the myths about this surgery. We want people to know the reality of this surgery. So that is why diabetes can be reversed with this surgery also.
Okay. Doctor, after surgery, బేరియాట్రిక్ సర్జరీ తర్వాత పేషెంట్ ఎలాంటి కేర్ తీసుకోవాలి? తర్వాత కూడా బరువు పెరగకుండా ఉంటారా?
So sometimes people don't realize that our human body is very complex and everything works on hormones. Now if there is a change in hormone, and that is why over a period of years, somebody does not gain the weight overnight. It takes years for somebody to gain weight. And obesity is more common in female because woman has to undergo 3 big hormonal changes. First, when they get puberty and their menstrual cycle starts, that's the first time they have very strong hormonal surge. Second time, when they get pregnant, every time with the pregnancy their hormones change. Third thing is, when they reach the age of menopause, again there are a lot of hormonal changes happen, and during these 3 phases they gain lot of weight.
Okay.
Now the thing is, once they have surgery, we are resetting the system, but one need to understand that you will lose weight, everything will look great after surgery, but maintaining that weight is the responsibility of an individual.
Okay.
Dr. Abhishek is not a magician. I cannot change the world. I can just reset the system. Once the system is reset, how you use your computer depends on you. If you're not careful, the virus might come back.
Okay. సో అసలు ఈ బేరియాట్రిక్ సర్జరీ అంటే ఏం చేస్తారు డాక్టర్? అంటే మాకు ఆకలి వేయకుండా ఉండడానికి, తక్కువ తినడానికి ఏం చేస్తారు మీరు?
So again, very interesting question. Bariatric and metabolic surgery, first thing, it is not a cosmetic surgery. Second, it is done by laparoscopy or by robotic, by which I mean we make small holes in your abdomen. We put our instrument inside, we look into your abdomen, your intestine and other part, and then we take out a portion of stomach which secretes bad hormone, which is also called ghrelin. Now this hormone is responsible for many things, including insulin resistance, making you hungry, making you diabetic. So if there is a bad hormone, there is a good hormone also. These good hormones are secreted by end of small intestine. These are the same hormones which you are getting on these new drugs, these weight loss drugs which have come up, Ozempic, Mounjaro and all these drugs. They have the same hormone which is naturally secreted by our own body by the small intestine. Now once we do this surgery, this bad hormones from the stomach goes down and the good hormones from your intestine goes up. So there is a balance which happens, and that is how this surgery is effective. A lot of people used to think that after surgery, because your stomach is small, you cannot eat more, that's why you lose weight, which is wrong. It is all because of the hormonal changes.
Okay.
It is not because you want to willingly control your hunger. What if somebody has a lot of hunger? He'll try his level best to control hunger, but eventually he gives up and he starts eating, right? Once you start eating, again you have a guilt and then you again gain weight.
Okay.
What happens after surgery is, because of the change in hormone, your brain will send signal to your intestine, to your stomach that, oh, you're full, don't eat much. I feel happy. You eat small portion, suddenly you feel full. And that is why you have early satiety. Your hunger level goes down. And that is how this surgery works.
Okay. So after surgery, after bariatric surgery, ఎవరైనా మళ్ళీ వెయిట్ గెయిన్ అయ్యి మీ దగ్గరికి వస్తే ఎలా ట్రీట్ చేస్తారు డాక్టర్?
So as I was telling you, somebody who has a knee replacement, doctor tells them that this knee will last for 10 years.
Okay.
But it can also last for 20 years or 30 years. It depends on how you are using that knee replacement. The same thing applies to a cardiac stent. If you have a stent, doctor will tell you to improve your lifestyle, and the stent will be savior for you lifelong. The same thing stands for bariatric surgery, that if you have a bariatric surgery, you lose weight, and if you are able to maintain that, definitely you can maintain that weight for lifelong. In fact, a lot of my operated individuals, they have run marathons. They are going for treks because they understood that this is what they wanted in life. They have seen the bad part. They have seen people making fun of them when they were overweight.
Yeah.
They had gone through a lot of social problems. They don't want to go back. So that's why they do it.
సో మెయింటైన్ చేయడం వెరీ ఇంపార్టెంట్ అని చెప్తారు డాక్టర్.
Very important.
ఓకే డాక్టర్, అంటే బేరియాట్రిక్ సర్జరీతో జనరల్గా ఎంత వెయిట్ తగ్గుతుంది అంటే ఏం చెప్తారు? లైక్ ఒక 100 కిలో ఉన్నారనుకోండి పేషెంట్, అప్రాక్సిమేట్కి.
Yeah. So there are strict guidelines. People who can undergo bariatric surgery and people who should not. So I do get a lot of young girls, they are slightly overweight, they want to undergo surgery. So I tell them strictly no.
Okay.
Because it has its own indication, and it is very important, since you asked me this question, we decided depending on the body mass index, which is called BMI, and BMI is calculated by your weight and your height. Now you have Google, anybody can calculate their BMI.
Yeah.
Now the important thing is, normal BMI for an individual has to be less than 23.5. Now beyond 23.5, these are the latest guidelines, by the way. Before it was 25 BMI, now it is 23.5 for Indians. Anybody who has a BMI of more than 23.5, they are considered overweight or obese. Now criteria for bariatric surgery is anybody who has a BMI of more than 32.5 and related comorbidities, they are the individual who can go for bariatric and metabolic surgery. Speaking of diabetes surgery, anybody who has a BMI of more than 27.5 and uncontrolled diabetes, they can go for metabolic surgery. So this is very important. Anybody who does not qualify the criteria should not get operated. It is medico-legally also important.
ఓకే సో మీకంటూ కొన్ని రూల్స్ ఉంటాయి డాక్టర్, ఏ పేషెంట్కి బేరియాట్రిక్ సర్జరీ చేయాలి అనేది. సో అందరికీ అది పాసిబుల్ కాదు అంటారా?
Yes. So as I mentioned before, anybody who does not qualify this criteria should not go for surgery, as well as a surgeon should not also operate on these individuals because they are not the right candidate.
Okay.
Because it is a life-changing surgery, definitely, but it should be adopted only when it is indicated, not just like that.
ఓకే డాక్టర్, జనరల్గానే ట్రీట్మెంట్స్లో అంటే డేస్ అవుతున్న కొద్దీ అప్డేట్స్ టెక్నాలజీస్ వస్తూ ఉంటాయి. సో యు ఆర్ లైక్ రోబోటిక్ లాప్రోస్కోపిక్ సర్జన్. సో బేరియాట్రిక్ సర్జరీ ఎప్పటి నుంచో ఉంది. సో ఇప్పుడు కొత్తగా వచ్చిన అప్డేటెడ్ టెక్నాలజీ ఏంటి అంటే ఏం చెప్తారు?
So laparoscopic and robotic surgeries are almost same.
Okay.
Now what is the difference? A lot of time people think that when we say robotic surgery, they think that robot will operate the patient and doctor will sit and have his coffee, which is not true. So they are called slave robot. What is a slave robot? So basically the instruments are same. Whatever we do in laparoscopy, the same thing happens here. We make small holes and we put robotic instrument. Now the important thing is it is like playing a video game. So these are very advanced technology. So we sit next to the patient. That's patient card where this robo is docked, and we sit next to the patient. We look into a 3D immersion view, and the control is in our hand.
Okay.
Now whatever movements we make on that console is reflected inside.
Okay.
So this is the latest technology. Now you might ask me how it is better than laparoscopy.
Yeah.
So laparoscopy, we have to look into the camera and operate. So it is more like hand-eye coordination. But obviously sometimes we have very long surgeries, 6 hours, 7 hours. So we are standing, operating, we get tired, we get fatigue. And when we get fatigue, obviously the efficiency goes down.
Okay.
What robotic has done, I use a word called precision. What is precision? It has made life easy for surgeon, for patient, and technology has improved the way we can operate.
Okay.
It will not make you great surgeon, but it will make better precision. You can operate in better way. And in fact, there are a lot of research publication which has proved that after robotic surgery, the pain is less. The recovery is very quick and fast. In fact, most of my patients, irrespective whether they are 100 kg or 250 kg, they walk within 3 hours after procedure, and they go home in 72 hours.
Okay.
In fact, sometimes it has happened that it's very funny. I operated upon an individual. She was very anxious about pain. And continuously before surgery, she was asking me, doctor, will I have pain? Because I had my cesarean, it was very painful. Then I had my gallbladder surgery, it was very painful. I didn't want to say anything to her, but after surgery when I went and when I asked her, how are you feeling? She asked me, doctor, did you really do surgery? Because I don't have pain. So sometimes, the technology can improve the outcome, and it can really help an individual to operate in a better way, as well as a patient, you also feel comfortable that yes, you have been operated by the latest technology.
ఓకే. సో రోబోటిక్ అనేది ఆబ్వియస్లీ ఇట్స్ అప్డేటెడ్ వర్షన్ కాబట్టి కొంచెం ఎక్కువ బడ్జెట్తో.
Yeah, so now the thing is the robos are from US, robos have come up from India, and we are very proud to say that a lot of Indian companies have come up with their robo. So the difference comes because these robotic instruments are quite expensive.
Okay.
But I think the difference is hardly around 1 to 1.5 lakhs. That's the only difference.
Okay.
If you're going for laparoscopy and if you're going for robotic, this slight difference happens. But now with advancement and with a lot of government interfere, these prices are going to come down. Okay. So probably maybe in another 2, 3 or 4 years, laparoscopy and robotic surgery will be same cost.
ఓకే, బట్ కంఫర్ట్ ఎక్కువ ఉంటుంది.
Yes, comfort is definitely much better in robotic. In fact, I think a lot of people have insurance now.
Yeah,
so insurance is also covering robotic surgery now. So that is very important. So anybody who is buying an insurance, or if you are renewing your insurance policy, health insurance policy, make sure that you ask your agent or your company to include robotic surgery, because in future that will help you.
ఓకే డాక్టర్ ఆఫ్టర్ బేరియాట్రిక్ సర్జరీ నార్మల్ లైఫ్ లీడ్ చేయడానికి ఎన్ని డేస్ పడుతుంది? ఎందుకంటే ఇప్పుడు అందరూ వర్కింగ్ ఉమెన్ ఉంటారు, సో వాళ్ళు కొంచెం అంటే మళ్ళీ ఆలోచిస్తారు, సో ఎన్ని డేస్ పడుతుంది మళ్ళీ నేను నార్మల్ అవ్వడానికి? సో ఆఫ్టర్ సర్జరీ హౌ మెనీ డేస్ ఇట్ విల్ టేక్ టు రికవర్?
It will not take days, it will take only hours.
ఓకే.
In fact, a lot of my patients, they are in IT company. So they come with their laptop. A day before surgery, they work till evening. Next day get operated. Very next day, within 6-7 hours, they again sitting on their laptop, they can start working.
Work from hospital.
You work from hospital. That's a very new concept. So the important thing is, this is what is called ERAS, Enhanced Recovery After Surgery. This is a term which has come up because we don't want, we want this experience to be a good experience. When we were kids and if somebody is admitted in the hospital, the whole family used to be stressed out.
Yeah.
Because going into the hospital itself is a stressful thing. But now with lot of technology and advancement, it has become a norm and it has become very easy for anybody to go to hospital, have surgery done, and immediately you can start working. Even for working women, homemakers, it has become very easy, and that is why I always tell them that please don't be scared of surgery. You should be scared of the problems which can happen if you don't do this surgery. Now let me give you a simple example. All of us have traveled in aeroplane, and whenever we board up flight, the air hostess tells us, whenever there is a low air pressure, the mask will come down. First put it to yourself, then try to help others. So I always tell all the women that if you yourself is not healthy, how are you going to protect your family? So first you should use a mask. It does not make you selfish. If you are not, see, unfortunately in India, all women think that if I pay attention to my whole health, I am being selfish. So they sacrifice a lot, and by the time they realize that they have lost their health, it's already too late. They have already reached their 50s. Now they can't reverse their age.
Yes.
So it is very important that all of us should set priority, and the first priority, no matter whether you are 20s, 30s, 40s or 50s, the first priority should be your health.
Okay.
And in India, we call it sick care. We go to the hospital only when we are sick.
Yes.
We should be going for preventive health care. We should not be going to the hospital when we fall sick. We should be going to the hospital to avoid any sickness in the future.
Okay.
So that is a very strong message which I want to give to the society through your channel.
Okay, definitely we'll follow, doctor. So one personal question. So doctors ante general ga cardiologist avali, ఆర్థోపెడిక్ ఇలాంటి స్పెషలైజేషన్స్ చూస్ చేసుకుంటారు, న్యూరాలజిస్ట్. సో వై డాక్టర్ అభిషేక్ బేరియాట్రిక్ సర్జన్ అయ్యారంటే ఏం చెప్తారు? మిమ్మల్ని ఏమైనా ఇన్స్పైర్ చేసిందా?
I have given many interviews in news channel. Nobody has asked me this question, and I'm glad that you asked me. I'll tell you, if you look into my family picture, I would look the odd man. Why? Because my family has diabetes, my family has obesity.
Okay.
Now I realized it 15 years back, and I used to really feel bad when somebody used to mock somebody who's overweight and obese, and I felt very bad. So one day I was talking to one of the fellow surgeon, and he told me, you are doing great, why you want to pursue in bariatric? I told him that this is a very satisfying surgery. So surgeon has, I should be able to make a lot of difference in their personal life, not just the health wise but their social life also. And that is why I choose to be a bariatric surgeon, because it was so satisfying when I operated upon a young lady who was struggling with her weight, body image issues, lot of social stigma. And then she came back to me and said, "Doctor, you have given me a second life. Now I am much more confident. I can handle any situation. My thinking, logical process has improved, and I am doing great in my life." So she had never thought that such day can come into her life, and that really made me realize that okay, this is what should I do. And in fact, I started doing this surgery 15 years back. A lot of people used to say me that there is no future for bariatric surgery, but I said this is my passion. I see it as a passion because I am changing one person's life, and then it might change their whole life, their whole perspective. Because obesity not just brings health issues, but it also brings depression, it also brings lot of confidence issue, it also brings lot of interpersonal and marital issues. So that is why I feel that everybody deserves a better life, and that's what I'm trying to do.
వావ్, గ్రేట్ డాక్టర్. సో యంగ్ గర్ల్స్కి ఈ సర్జరీ అనేది మీరు చేయమని చెప్పారు కదా డాక్టర్, అంటే ఎవరైనా యంగ్ గర్ల్స్ వచ్చి చేయమంటే చేయము అని చెప్పారు, దానికి కొన్ని రూల్స్ ఉంటాయని చెప్పారు. సో ఎట్లాంటి ఏజ్ని మీరు ప్రైమరీగా కన్సిడర్ చేస్తారు? లైక్ 18 years గర్ల్స్కి కూడా మీరు బేరియాట్రిక్ సర్జరీ చేస్తారా? వాట్ ఈస్ ద మ్యాక్సిమం ఏజ్?
So according to the guidelines, anybody who has age more than 18 years and up to 65 or 75 years we can operate. But I have operated some young adolescents also. So if you're operating on young adolescents, you should take a proper board consent from pediatrician, endocrinologist. You can operate on young kids also if they have syndrome. But very important thing which you asked me, I'll give you another example, another real story. A lady who was working in Dubai, she came to me and said, "Doctor, I have a very strong family history of infertility, polycystic ovary, and none of my family members could conceive until unless they had an IVF and multiple IVF cycle." She was about to get married. She came with her partner, and her body weight BMI was around 39. And she already had all those symptoms of insulin resistance. I told her, see, I cannot give you a guarantee, but definitely the research says that once you lose weight, your fertility improves. She underwent bariatric surgery. She went back to Dubai. And within 1 month, she sent me a message that, "Doctor, for the very first time, I am getting my normal cycles without taking treatment, and I feel like a complete woman." It was such a great message from a woman because she was very happy. After few months, she sent me another message that, "Doctor, I am pregnant without any treatment. I just wish that and pray to God that things goes normal." And then I just forgot about it, and suddenly maybe 9 months later, she sent me a picture of a girl. She said, "Doctor, you are the first person to see my daughter because I think without you it would not have been possible, and I am surprised, everybody in the family is surprised that I did not require any IVF treatment, no problem, nothing, first time conceived and first time delivered baby child." So it is very important for us to understand, as I told you about this example, if you're traveling in a flight, the mask comes down, you have to first protect yourself. The same thing stands true to any individual, any female, because going through IVF cycles itself is very traumatic, and every time you undergo IVF cycle, it involves a lot of money, it changes your hormone. And you need to believe in one thing: if you're not able to conceive, it means that you're not prepared for it. The nature will not want you to get pregnant because your body is not prepared. So it is something which you're unnecessarily trying to do when God does not want it. So I tell them that maybe you're not prepared for it. So let us first prepare you for conceiving, because conceiving is just one part. Delivering a healthy baby is this another important part, and having sleepless night with babies is most difficult part. Raising a children is the most difficult part. So you just don't get carried away by this thought of getting pregnant. There are a lot of things involved later on. So are you prepared for that? So sometimes I act as an eye opener for them, and then they are like, "Yes, doctor, we were going crazy about having a child because everybody was putting a pressure on us that have kid, but we never thought that how to go ahead after this." So then they realize it, and I'm trying my level best in that.
వండర్ఫుల్ డాక్టర్. సో ఫైనలీ ప్రైమ్ మినిస్టర్ మోదీ కూడా ఈ ఇష్యూని రైజ్ చేశారు, లైక్ ఒబెసిటీ అనేది భారతదేశంలో ఎక్కువ అయిపోతుంది అని. సో యాజ్ ఎ బేరియాట్రిక్ సర్జన్ మీరు జీ తెలుగు న్యూస్ ద్వారా ఏం మెసేజ్ ఇస్తారు, ఏం సజెషన్ చెప్తారు ఫైనలీ?
See, I totally agree with what Honorable Prime Minister said. If we don't realize this now, our future generation is going to suffer, because I am seeing lot of childhood obesity, and probably maybe after 20 years Indian government will have to spend lot of money when we have unhealthy next generation. And I want to give a very strong message through your media. You know, the biggest enemy in our life is sugar.
Okay.
The biggest enemy. I want all of you, I request all of you that please cut down on your sugar. It's not the oil, it's not anything else but the sugar. And when I say sugar, I mean any kind of sugar, whether it is in the form of chocolates, cold drinks, or whatever you see. Not everything which is sold by celebrities and which is being promoted is good for you, because after all it is your health and you can't ignore it.
Okay.
Thank you so much.
థ్యాంక్ యూ డాక్టర్. సో చూసాం కదా, డాక్టర్ అభిషేక్ కటక్వార్ చెప్పిన సూచనలన్నీ డెఫినెట్గా ఫాలో చేయాలి. ఎందుకంటే భారతదేశంలో ఇప్పుడు ఊబకాయం అనేది ఎంత ఎక్కువ అయిపోయిందంటే ఆ విషయాన్ని ఇండిపెండెన్స్ డే రోజు ప్రధాని మోదీ ప్రస్తావించడం జరిగింది. ఎందుకంటే ఫ్యూచర్ జనరేషన్స్ డెఫినెట్గా హెల్త్ మీద దృష్టి పెట్టాలి, ఈ ఊబకాయాన్ని తగ్గించుకోవాలని చెప్తున్నారు. అయితే ఈ బేరియాట్రిక్ సర్జరీ వల్ల ఊబకాయం తగ్గడమే కాదు, దాంతోపాటు ఇన్ఫెర్టిలిటీ తగ్గుతుంది, ఫ్యాటీ లివర్ తగ్గుతుంది, డయాబెటీస్ తగ్గుతుంది. సో ఇలాంటి ప్రాబ్లమ్స్ అంటే ఓవరాల్గా హెల్త్ ఇంప్రూవ్ అవుతుంది. అసలు అన్నిటికీ ఊబకాయమే చాలా ఎనిమి అని చెప్తున్నారు డాక్టర్. డెఫినెట్గా డాక్టర్ చెప్పినట్టు మనం ఈవెన్ అంటే మనకి సొసైటీలో ప్రెషర్ కూడా ఉంటుంది, తర్వాత డిప్రెషన్కి గురవుతారు ఓవర్ వెయిట్ వల్ల. సో మన ఫుడ్ హ్యాబిట్స్తో, లైఫ్ స్టైల్ చేంజెస్తో అండ్ ఫైనలీ సర్జరీతో డెఫినెట్గా దీన్ని ఓవర్కమ్ చేయొచ్చు అని చెప్తున్నారు. ఇది వాళ్ళ స్పెషల్ హెల్త్ షో. స్టే ట్యూన్ టు జీ తెలుగు న్యూస్.